Hi, everyone. Welcome to the second episode of the question and answers on Corona. Again, a thank you to Mendel for helping me set all this up. As you can see, last time how things have changed. Last time I was sitting in Mendel's home. And this time I'm in my home as we are doing, uh, the more physical distancing. It's supposed to be called physical, not social, right? That's the new buzzword, not social, but physical distancing. And so Mendel's helping me out and we're in different places now. So we had a Google document that was sent out and a lot of people asked questions, which I will get to. Before I do that though, I wanted to just address two questions that have come up often, and I thought we should just address them. One question I'm getting quite a bit is people are at home and they say, well, I have symptoms that very well could be Corona. I'm coughing, I have some fever, runny nose, symptoms that we know are consistent with Corona, and should I get tested? So I want to just clarify that. In Israel, we're not doing pan testing yet. I'm not sure if we will or we won't. That hasn't been the policy up to this point, but we only test in certain situations. The tests are only allowed if you are someone who has been exposed to Corona, either someone who's a high risk because they've come back from a flight in the last, sorry, I'm going to just close this here. If they've come back from a flight in the last 14 days and now have symptoms, or if there's someone who was in direct contact with a known positive patient. Those are the two reasons. If you are in those two groups and then have these symptoms, then yes, they would test you. But otherwise, if you're someone who's never been exposed to any of these things, you've not traveled, you haven't been exposed to a known positive patient, and you have symptoms that are similar to Corona, you still won't get a test at this point. In Israel, that is not an indication for a test. That might change in the future, but up to my last discussion with the Ministry of Health, which is actually today, about that topic, there's no change in that yet. So for now, only those groups of patients will get a test. The other group, which is like less for this group, but obviously, if someone's admitted to a hospital with a very severe pneumonia, requiring support, whether it be intubation or oxygen or any of that kind of stuff, ICU admission, or a high level of care for a pretty bad pneumonia, then they'll test you for Corona as well in the admission to the hospital. But those are really the groups that are getting tested for Corona right now. The other question that came up a lot is about isolation. Who needs to go into isolation and what does isolation mean? So the only people I need to go into isolation again are the same two groups. If you were anyone who's come back from Israel or come back to Israel after traveling in the last 14 days, or anyone who's been in contact with a Corona positive patient, you need to go into isolation. And the isolation guidelines are all in English and Hebrew, obviously on the Ministry of Health website. There's a lot of question now about this isolation when you have a cold, because the Ministry of Health said everyone should be at home if you have a cold or fever or shortness of breath or any of these symptoms that could be Corona. This is even for the non-Corona group. It's not really the same isolation. The isolation, if your isolation for rule out Corona is more severe, you have to be in a separate room and all that kind of stuff. And, it's quite severe restrictions. Whereas basically they're saying if you have a cold and a cough and we're not going to test you for Corona because you don't fall into that criteria, still stay home. We want less people being sick, less exposure, stay home, but it's not the same kind of a super strict isolation protocol. So I hope that answers that question. And then we'll start moving on to the questions I got on the Google document. The first question was, can older people who have been self-quarantined the whole time have Seder together or a Shabbat meal without endangering themselves or the other couple? It's a good question. And I wish I can give you a better answer, but the answer would probably still be that's not a good idea. I mean, the point of being self-quarantined is to decrease exposure, especially to the elderly or those that are high risk. And then, we know that the coronavirus is spreading. We're trying to, again, like the buzzword is, keep the slope down or, flatten the curve in Israel, but it's still spreading. And so any exposure you have when you're someone in the risk, in a high risk group, even if you've been in quarantine the whole time, is definitely dangerous. And it definitely increases your risk. So I would say this is the time to not do that. God willing, we'll all have the rest of our lives to do that. But right now, for the next few weeks, and even the next few months, we're not sure how long it's going to last, but this is the time to not have guests, not invite other people over, especially if you're in the high risk groups. So maybe it's a good time to discuss the high risk groups. That wasn't, we discussed that in the last time. But again, obviously, anyone over the age of 70 is in a higher risk group. The slope starts going up by 60, but 70 really gets to higher risk groups. Anyone who has cardiac disease, diabetes, any kind of respiratory lung illness like asthma or COPD or emphysema, anyone with any kind of immunodeficiency syndrome or taking medications that decrease the immune system like steroids or like Remicade for Crohn's, for example, and patients that are in that category are the ones that need to be especially more careful. Everyone can hear me well? Yeah, I'm getting a nod. Excellent. Okay, good. The next question. What is your best guess for how long the situation of being homebound will last? No one knows for sure. I can't imagine this is, I think a lot of people think that after Passover, after Pesach, we'll all be it'll all be over. I personally highly doubt that. And from what I'm hearing, in the Ministry of Health, I think we're talking about more closer to months than weeks. But it's hard to know for sure. Right now, this might not even be the end of our homebound, the most restrictive. I mean, right now we're homebound, but we're still going out to the Makolet and we're still going for walks and we're still doing essential services. And today I was in Jerusalem in the Givat Shaul neighborhood, and it was still hard to find parking. So we're not really homebound yet. And there might be some more stricter conditions coming, with really not letting people out except for that, with more security and more fines and more police surveillance and all this kind of stuff. That certainly might be on the way. To be honest, for a little while, I might even welcome it. Anything that helps stop the spread for the next little while. I think the harder we go now, the harder we push, the more we're able to take now, the faster we'll be able to get out of this. That's certainly what the epidemiology shows and what the hopes are. So if we really sort of buckle down now, stay home, do our best to really leave the house as little as possible and as close as possible, the more we really buckle down now, I think the better chance we have of coming out of this in the relatively near future as opposed to months and months. So I wish I had a good date, a good time to tell you that we don't know. So we can certainly hope by May. I am doubtful. I'm doubtful, but we'll have to see. Okay.
David, please roll back one line.
I'm sorry. Roll back one line.
On the Google. Go back on the Google Doc. No. Line 3.
Line 3. Yeah. Okay. Thanks. Is there a safe way for older people to have cleaning help? Can they just stay in the rooms and the cleaner do other places with the glove and mask? What's the safest demographic to hire? Teens, adults, same. Okay. Again, especially with older adults, having cleaning help is not a good idea. Having anyone come over really is not a good idea. And really, it doesn't really matter the age. I mean, having someone who's younger doesn't really help you, because we know, especially in the younger population, they have the virus, or they can harbor the virus and be good vectors for the virus with being totally asymptomatic. And there's a huge percent of the population that can have corona, especially in the young, and have zero symptoms. So you could have someone in your house who seems totally fine and then catch it. So those who know me here on this group know that I'm a little bit OCD with the cleaning, but I will say at this point, if you're older in a high risk group, it's better to have a messy house, which is difficult for me to say, than to have cleaning help over, because again, it's just not worth the risk. The question about the glove and masks, we'll get to that as well. but that doesn't make much of a difference. We'll talk about the glove and masks soon when there's talk about the Macola and stuff. Okay. The next question was, what is your best guess for how long the situation will, okay, we talked about that already, sorry. Okay, here's an interesting question. My daughter and her soon-to-be fiance want to keep seeing each other. That's nice. But they live 2 hours apart and he is needed at home. Will they be able to somehow spend time together in person in the next few months, or only if they live permanently in the same home? We want him here with us. That's nice. Again, it's hard to answer that question. I mean, if you are not part of the nuclear family at this point, then again, the recommendations are not to be living in the same home and not to be living in the same place. You can certainly go for a walk 2 meters apart. That's nice. But I can't recommend at this point, and I don't think anyone would recommend, sort of living together, or unless, or sort of like visiting each other, then going back to each other's respective homes, if that's the question, really. I'm trying to understand the question, but they're like, having a meeting and then going back, or spending time together, then going back to your own respective homes, is again increasing the spread, increasing movement of the virus, and spreading it to other people, and probably not the best idea unless you're permanently staying in the same place together, and just those two people staying together. That's different. Obviously, that's okay. You're staying together, but not going back and forth is really the movement is what we're trying to restrict.
For what it's worth, Zoom is free for 2 people, unlimited time.
Oh, Zoom. Right. Okay. I guess the next question is sort of we touched on, but it was, what is a corona carrier and how long can one be a carrier? And that's a good question. I don't think anyone knows for sure, but I'm not sure what you mean by corona carrier. Maybe you mean someone can have the virus and be asymptomatic. We know that people usually, if they get the virus, that's what we recommend, the 14 days, because usually there's some kind of, you have some kind of symptoms within those 14 days. So people who are asked to be in isolation for 14 days, and if they develop no symptoms, they're allowed to be out of isolation. So we assume about 14 days. Carrier is a bit of a different connotation in medicine. Usually means someone who carries something for a long time. Well, here it's sort of an asymptomatic infection, which is a bit of a different thing than a carrier. Like a strep carrier can happen for many years, whatever. But someone could be having corona for 2 weeks, and especially in the young, like I mentioned, can have corona for 2 weeks and still have zero symptoms. And little kids can never even have a symptom at all, which is really why why they close schools and trying to stop the spread between kids relatively quickly in all this. And Israel was actually quite good with that. Did that quite early in the game because we know that children are excellent vectors for this virus, and you often don't know. I hope that answers that. The next question is actually, is a person with a cold more susceptible to corona? It's actually an interesting question scientifically because the cold is also a coronavirus, right? We call this virus corona, but there are different coronaviruses. The common cold is a coronavirus. SARS, if anyone remembers SARS back in the day, I think it was 2009. SARS is also a coronavirus. There are different MERS, which is another kind of virus that goes in the Middle East. That was also a coronavirus. So I'm not sure having a cold makes you more susceptible. Not that I've heard, at least. So does having one coronavirus make you more susceptible for the COVID-19 or this novel coronavirus? And I think the answer is no, at least not that I've heard. But again, this is something we're totally learning about all the time. It's completely new. We've never had this before, and we're still learning about it every day. Okay, I'm gonna move along. Well, thank you, my little, I think I read for me there. Once you've contracted COVID-19, are you immune or can you catch it again? So we've had that question as well last time, and the answer is it seems like you can likely have immunity from everything we know about these kind of viruses. Once you get it, you are immune. Do we know 1,000% yet? No, because it's the first time we're dealing with this, and people are just recovering, and we're starting to study these people and see if they actually have immunity. And It seems like there's been some sort of news. I've said people getting reinfected. I don't know if anyone's seen that in the news about these reinfections with coronavirus, and that often they seem to think that that happened because of a false negative test. That the test, when they finished their symptoms, they tested them and they said they're negative, but actually they were still positive. That sometimes the test isn't 100% yet. Some of the tests they were doing aren't 100%. So I don't think it was a real, it seems to be, no one's 100%, but it seems to be it wasn't a real reinfection, but more one false negative test, and the patient was still positive. That's why in Israel, for example, all the patients who are corona positive, but to know that they've recovered, they require 2 separate negative tests spaced out in time. So Israel's being careful with that. They're actually doing a good job of doing 2 completely negative tests and not back to back. They want to make sure that you have a space between and the patient's really completely recovered from corona before they're let back out into the world. So I guess I hope that answers that question. Next question is, I'm a 32-year-old with asthma. How nervous should I be? Well, it's a good question. Being 32 is a good age, right? It's more than a decade younger than me, but also it's we know that under age 60 and especially in the 30s and 40s, very, very low risk. The numbers seem to be under 0.3% of having any serious complication. There's always outliers, of course, and you see in the media often young people with a pretty severe disease. It happens for sure. There's enough people infected that 0.3, 0.4% isn't a small number when you're looking at so many people infected and potential infections. So you're going to see those outliers. But overall, compared to 20% or close to 20% in the ages over 70 and 80, then it's a pretty low risk. Asthma does increase the risk, however. I'm going to just find this here. Exactly, I want to give you the right numbers. Give me 1 sec, I'm sorry. There we go. All right. So we by age and by respiratory disease. Okay, so chronic respiratory diseases can increase your risk now in the studies up to about 5% of having a serious complication. But again, remember, they're looking at serious disease like chronic obstructive pulmonary disease and other diseases that asthma is included under, but that happens more in the elderly population. So the truth is, a patient with asthma who's 32 years old, when I quote that 5%, that really doesn't apply. It's probably much, much lower than that because those studies are looking at all comers of all different respiratory diseases. The bulk of that the bulk of that happened in an older population. So a young patient with asthma, again, somewhat of an increased risk and have to be more careful. I would be more careful, and I would, whatever they're recommending, I would maybe be a bit more strict, but it's not really that huge risk like that older patients with chronic respiratory diseases have. Okay. What precautions should supermarket workers take? I'm getting a lot of questions about the supermarkets. So going to a supermarket and what precautions should you take in a supermarket, and should I wear gloves in a supermarket, and should I wear masks, and should I go to a supermarket? I'm just trying to think where to start. Obviously, the less we go out, the better. But people are still going to supermarkets. I'm still going to the supermarket. I mean, that's still considered under the essential services. Everyone, we need to get food. And the exposure in a supermarket, again, we should be maintain the physical distances. You shouldn't be really close to someone. Supermarkets shouldn't be letting in a huge crowd at one time. The exposures are relatively small because you're not really standing, you shouldn't really stand and have a conversation with someone, at a close distance. You should be more passing people quickly, getting what you need. It's not like the same risk of sitting in a home and having a conversation with someone close by. Again, it's sort of a quick in and out, get what you need and go. When it comes to, I see a lot of patients, working. I see a lot of people going into supermarkets and using gloves. So a little rant about gloves. You don't get coronavirus by touching things. Coronavirus cannot be transmitted through the skin. You get coronavirus if you touch someone or touch something that has coronavirus and then touch your face. So I often see people wearing gloves and touching all the stuff in the makolet or in the whatever in the store, and then they're putting in their bag and they're wiping their nose, or they're touching their face with a gloved hand because they think they're protected, and that's just doing the opposite. So if the glove makes you less, if you're without gloves and you're more in tune because you say I'm not wearing gloves, so I'm going to be more careful about not touching my face. That's a much better option than wearing gloves, going into the makolet, and then just forgetting that, touching your eye, rubbing your eye, touching your nose, touching your mouth with a gloved hand. Also, you have to know how to put on and take off, especially take off gloves. After you've worn gloves, it's very easy to reinfect yourself by taking off the glove with one hand, taking off the glove with the other hand. And the degloving is a whole process in medicine, how to deglove properly when you want to not infect yourself. So, I'm not sure about the usefulness of gloves in the makolet. I know it makes people feel better. It makes you feel more calm and less anxious. I guess your emotional health is important too. But I'm not so sure of the effectiveness as opposed to just going to the makolet, not touching your face, coming home and washing your hands, and unpacking and washing your hands, as opposed to just wearing gloves. I also started to see a lot of people wearing masks, right? The surgical masks or other kind of masks. It's important to point out an important point about that. Those masks are for someone who is sick. It's to keep disease in, not to prevent you from getting sick. So if someone, again, the pores of the surgical mask are much bigger than the virus. The virus can go right through there. So you're not protecting. If you're walking around with a surgical mask thinking I'm not going to get coronavirus, you are fooling yourself. It does not prevent you from getting the virus at all. What it does do is if you are someone who is coughing and sneezing and whatever, it keeps your respiratory, those big chunky respiratory droplets to yourself, and it makes you cut your face less. So if you're someone who is, have a, sneeze and then wipe your nose with your hand and then touch something else with it, then, you'll do that less because obviously you can't touch your nose or your mouth when you're sick. So masks are for someone who is sick, who should be home in general and not be out. But if they're whatever, for some reason have to go out to a doctor or whatever, they wear a mask so they shouldn't start spreading infection everywhere by touching their mouth and touching their nose and touching things. But if you're healthy and you're walking around wearing a mask and someone sneezes on you, that mask's not going to do much for you. So I don't wear a mask when I go to the makolet, for example. I don't think it's so useful. Studies show it's not useful. And so that's the rant on gloves and masks. Getting stuff home from the makolet, I guess we'll get to that. Again, people are asking, do I have to wash my things? Should I wash the groceries? I'm not sure how you wash, you start washing bags of cereal. I'm not sure how to do that. But that would be very, very lengthy process. I think, listen, I know we're all hearing things about the virus living on surfaces and it lives on metal more and it lives on cardboard. It could live on metal for a few days and it could live on cardboard for a few hours. And those are sort of, ideal laboratory conditions. But like going to the makolet or going to the store and bringing home food, and putting it in a plastic bag and bringing it home, it's cold. The virus is like, jostled around and you need like a really high concentration of virus to like touch something like a cardboard cereal box, then touch your face all over the self. And, to really inoculate yourself with enough of the virus to like get corona, you have to like have a lot of virus concentrated on that product, touch it and then smush it all over your face, which hopefully none of you are doing. So, I think that if you, I don't wash down my makolet stuff I buy. I'll try to be very careful about, not touching my face, which is like, again, gloves won't prevent that, but because gloves are just as dirty as your hands when you touch everything. So just get the stuff, put it into your whatever, and wash your hands, and yeah, and that's I think a much better option than sitting there and wiping down, with a wipey every single banana or every single box of cereal you got. I think it's probably better use of your time. Someone's asking quickly, and is that Rami Levy or Makola? Oh, we'll get to that. Sorry, that goes for anywhere, any kind of produce or any kind of products you're buying from Makola. So that's sort of my little spiel or my little rant on gloves, the masks, and wiping things down from the makolet. Of course, if you're in the elderly or if you're in the higher risk populations, then obviously any less chance of going out of the house is better. So we'd rather have delivery if possible. Does that answer the question there about the makolet? Hope so. Nods. Yeah. Okay. Mendel, we're good. Okay. Okay. I'm going to read this question for myself and I'll summarize it. This question is about the Ezra Hadadit, or basically, people making food for others who need it, people who need extra help. What are the recommendations for food preparation? And that goes, I guess, also with, or takeout. I mean, I'm not sure there's a major difference between takeout, right? It's kind of same, kind of like prepared food, bringing prepared food into your home, either by takeout or people making food for others. Right now, the recommendations from the Ministry of Health are that it's okay, and restaurants are cooking food, and it doesn't seem that people are catching coronavirus from takeout or from food or prepared food from others. Again, that's not really. Try to think of it like the main way people catch coronavirus is really by the droplet transmission. Is it theoretically possible? Has it happened? Maybe, but this is not the main way this virus is spreading. Does that mean I would just do whatever? No, I'd be careful. Am I still getting takeout? Yeah, I still ordered hummus from the hummusia on Shabbat. Because it's really not, I mean, again, you need a high amount of inoculation, a large amount of virus on one thing that then survives till it gets to your house, and then touching it and smushing it all over your oral pharynx, your nose, your eyes, your mouth. Again, not really the main way this thing is transmitted. And, I think at this point, if you're if you're comfortable with the establishment, then I don't see a reason not to take out or get takeout or prepared food at this point. Hope that answered that question. Next one that pertains to me as well. Can I get a haircut from a barber before Pesach? If so, what do I do to make it? What do I need to do to make it safe? I probably need a haircut as well, and the answer is really no. I looked into that as well. Not just because I needed a haircut, but I got that question from others in this issue. And, that's really kind of like the opposite of physical distancing. It's very hard to get a haircut from someone who's a meter away from you. Possibly not impossible, but but I've seen some interesting YouTube videos coming out of China of people doing some interesting kind of haircuts with long things. But like at this point, unfortunately, I cannot recommend getting a haircut. All the barbers and haircut things places are closed. Actually, the Ministry of Health put out a clear directive: any kind of non-essential service like massages or nails or cosmetician type things or any of that stuff is not recommended. Actually, not allowed. Haircut kind of falls into that. You're sitting in a chair next to someone right on top of you, right on top of you, basically cutting your hair, and then that over and over other people. Again, just not a good idea. Unfortunately, before Pesach and with Sfira Omer coming, I know people are going to look shaggy, but it's all right. We can deal with the shaggy hair for this year. Okay. Maybe we'll skip line 14.
No. The
No,
question reads, can Dr. Zlotnick be any more awesome? And if yes, how?
Well,
All right,
move on to question.
now you can go on.
We'll move on. Thank you. We'll move on to question 15, which is again an important question, and one I'm getting a lot about the mikvah, going to a mikvah. Let's read out the question. In regards to the mikvah, I know there have been many different things put out saying it's fine, but what about the water and all these people? Is it okay? I understand if you'd rather not answer the question. I don't mind answering the question. So for anyone here who doesn't know what a mikveh is, just in case, it's a ritual bath that's used. Okay, so I looked into that as well. It does not seem to be, or it's pretty much known that the virus cannot be transmitted through water. So that's that. So we can put that out of our heads. As well, there's also been a directive from the Ministry of Health and from through the chief rabbinate that they're being extra careful in the mikvah, and they're actually adding chlorine, and there's a whole, all these directives that are put out that I went through in Hebrew about adding chlorine and extra this, and so they're being extra careful just in case. But I don't think the mikvah is really that different than going to the makolet, maybe when it comes to contagion. I don't think you're just as likely to not or yes catch it from someone there who has it, who then coughs on you or something, than you are at the makolet or anywhere else you're going to go. And the same precautions, keeping distance and washing your hands after and all that kind of stuff. But actually dunking in the mikvah when it comes to COVID or coronavirus, I don't think that does not seem to increase your risk according to literature. And so water does not seem to be something that transmits the virus in that way. So I know like a lot of people were thinking that because the swimming pools everywhere were closed, but that's more because of the tons of people together in one spot, not so much because of the water. Okay, is that all right? Sorry, I'll take a sip of tea here in my throat. Hold on. All right, I'll move down here. The next question. How are we doing with time here? 9:02, boy. Okay. If you are in quarantine and need to walk your dog and you can't find someone else to walk them, is it okay to go out for a fast walk with the dog? The answer to that question is a big no. When you're saying quarantine, I assume you mean not all of us, because we're all in some kind of quarantine. I assume you mean what we call in Hebrew someone who has to be in bidud, someone who's in isolation because either they came back from a flight or because they were in contact with a corona positive patient. If you fall into that category and you are now in the true, real isolation bidud that we know, that would be a criminal offense to go walk your dog even for 5 minutes outside your house, punishable by prison sentence and a 5,000 shekel fine. So, maybe someone else can walk the dog, but I cannot recommend walking the dog. Sorry. Okay. The next question is again
David,
about the mikvah.
David, for that, I would suggest the person post on the Yishuv email list, and I'm sure there are plenty of kids out there who would be eager to help walk the dog if the parents let.
Yeah, that's very true, especially now. It gets them out for 10-15 minutes for sure. I'm sure someone else can walk your dog. Yeah. The next question was again about the mikvahs. There was a person who went to the mikvah. Yes, there was a person who went to the mikvah who was in a frat who went to the mikvah and ended up having coronavirus. Now I'm scared to go because I'm high risk. Should the Ministry of Health close the mikvah? So again, my answer is if you're high risk, then the risk of going to the mikvah is the same as the risk of going to the makolet. Again, it's the same. It's not a more risky because of the water or anything like that. That's your personal decision. I know I don't want to get into Jewish law or halachic here right away, but if anyone wants to see what was put out by the rabbinate about people who are extremely nervous about it and anxious and delaying mikvah and all the Jewish law about that, I have a file that I can send to you. You could message me privately, and I can share that. But again, there's no real increased risk from a mikvah as opposed to really anywhere else that's in a public space and whatever. Keeping safe in airports. Oh, sorry, I missed one here. This is about the makolet stuff. We talked about that. Cleaning all the groceries. We talked about that. I will be in transit, 2-meter space. Oh boy, someone asking about being in an airport. I mean, the airport's a super high risk with a lot of people, and any kind of flight makes you, anyone who goes to an airport and anyone who goes on a flight needs to be in isolation for 14 days. So are there any ways to keep safe? Is not go to an airport, because once you're in the airport, it's considered so high risk, you need to go in isolation, forced isolation after that. So there's nothing I can tell you except, just again, if you need to go for any reason, and sometimes just people have no choice and they have to be in an airport, then you got to just, be as careful as possible when it comes to keeping your distance and washing your hands a billion times and all that kind of stuff. There's nothing magical about that. And again, any flight and being in close quarters, that is high risk, and that's why anyone like that is being put in isolation. Okay, where am I here? Again, there's another question about shopping in the Makolet and disposable gloves and all that stuff. And I believe we spoke about that already. Sorry, one more. Here I am. What is the latest evidence suggesting the maximum incubation period for the virus from the moment of exposure to the onset of symptoms? Again, the reason why we're putting people in isolation for 14 days, because it could be up to 14 days. The sort of average peak of when people start symptoms is about 3 to 5 days, but can be up to 14 days. So that's the reason for the 14 days. For what period of time is an infected person shedding the virus and or contagious and able to transmit the virus? Good question. People are obviously shedding the most virus when they're symptomatic, but there's a lot of shed as well, even in the time before they're symptomatic. When you just catch the virus, you're already shedding it. And that's why we're being so careful about isolating anyone who was in contact with a corona positive patient, because even if you haven't developed symptoms yet, and you do 3 days later, for those first 3 days, you could be shedding virus. And so that's why we're putting people in isolation as soon as there's any kind of possible exposure, even if they feel totally well. How long are you shedding virus? It's a good question. I mean, we basically want the test to be negative. So you are theoretically, in isolation, and until you have 2 negative, this is in Israel, you have 2 negative corona tests, and then we know for sure you're no longer shedding, and then you're allowed back into the world. All right, again about wiping the groceries, we talked about that, and again, here's the Makolet. Is going to the Makolet activity to be avoided? We discussed that. Are we going to spread the virus by having people who are healthy yet shedding the virus interacting with other families? Absolutely. And that's the whole point of this. That's why we're doing this physical distancing. I'm trying to be good and not say social distancing. But yes, that's why we're doing all this distancing, is because that's exactly what the issue is. And that's what happened, in the 1918 flu pandemic, right? When you had, people shedding the virus all over the place when they were asymptomatic. And that's unfortunately likely what happened. In one of the many reasons was happening, the horrible situation in Italy, when people initially did not take the isolation seriously. And, they once said stay in your homes, and everyone went out skiing together and partying and all that stuff. And that's why the Ministry of Health, if you saw, was it last week when, they said to everyone to go home, everyone to stay in your home, and everyone was out in Tel Aviv on the beaches and chilling and all that stuff. And that's exactly the problem. All these people are feeling great, could be shedding the virus everywhere. And that's why personally I think things need to be a little bit even stricter before we release. Like I personally think we need to even buckle down a bit harder than they have been. But again, for everything you do, there's a consequence, and an economic consequence, and a social consequence, and all this stuff. But yes, people can definitely be shedding and transmitting to people when they're feeling well, and that's a major issue. Again, safe to order food from local restaurants. We touched upon that. Okay, that's a lot about the food. I'll move on to the next one. Thank you, Randall. Is it dangerous to be outside and pass people on the sidewalk? How far should we be from people when we pass? Theoretically, it's an issue, because someone can cough or sneeze and get a big load of virus right into your face, which you want to avoid. Again, passing people in general is okay, but again, as the distance they say is about up to 2 meters is the best. Being 2 meters away and passing someone, even if someone coughs and sneezes, you're usually not in the range of getting enough viral load into you to get an infection. And so that's why you hear a lot that 2 meters, staying 2 meters. away from people. Oh, here's a big question. Oh, I like this question. Washing hands with regular soap and water versus Purell versus antibacterial soap versus all this scrubs and all that stuff. Anyone who walked by Super Farm or any drugstore or anyone sees all the Purell totally sold out. There's been a lot of studies on this, and the soap and water is by far superior than to the Purell and all that stuff. You know, obviously Purell is better than doing nothing, but soap and water, much better, like leagues better than the antibacterial stuff, for various reasons. The antibacterial soaps can dry out your skin, and they don't kill the virus in the same way as soaps do. It has to do with the composition of the virus and the layers, and we're not going to get into molecular biology, but the soap and water is far superior than using a antibacterial gel.
David, is the 20?
Yeah.
Is it 20 seconds a hard requirement?
You mean 20-second washing your hands?
Yep.
It definitely should be up to 20 seconds or even longer, but not a quick little scrub, but a good getting in all the creases and everything. And that takes about 20 seconds. Kind of like the 2-minute brushing your teeth rule with the kids, I guess. I don't know, but like really getting in there and soap and water. Again, the bacterial gel, just the way the virus is, it will wash away the virus as much as just soap and water will. So although everyone's really, going crazy getting this, sold out everywhere, listen, it's better than doing nothing. But but if you can be disciplined enough to wash your hands with soap and water, you're far more safe than just washing for the same amount of time. Both are not equal. The soap is much more. Soap and water are far superior. Okay. My elderly parents live in Jerusalem. They are healthy. So far, they want to maintain their independence and stay in their own apartment. That's good. I would like to have them come to us on Passover. What do you think is the correct thing to do in terms of their health, both physical and mental? And isn't that the hardest thing? This is like the hardest question to answer, because I'm getting this question a lot for people who want to have their parents over for Seder. And I'm going to say this year, just don't do it. Again, God willing, you'll have other years. We've had many years, big families, Seders together. This is a once in a lifetime, hopefully, event that is happening to us. This has not happened to us in over 100 years. This is an unprecedented. And is it really worth, risking the lives of the people you love for one meal or for one thing? I don't think so. And as much as it's ingrained in us to have a big Seder and our families together and all this stuff, I know it's part of our, tradition, and it's close to our hearts. But this year, don't do it. I just don't think you should do it. I think this year, have a small Seder, do it with your own families. I understand how hard this will be, and I understand that, psychologically and emotionally it's difficult, but, and if someone's going to do it, there has to be a really big personal risk assessment. Do you think that's really worth that for this year? Again, this is not something that, we've ever had to have before. God willing, if we look at the epidemiology out of China, we will come out of this. They've now had a few days of having zero new cases. So if we could just not for 1 year have a smaller Seder and not risk exposure, especially to the elderly and our parents and those at most risk, they're the ones that will get sick the worst and the fastest and have the worst outcomes. And so I will say, not this year. But that's just my opinion. Everyone, of course, will make their own personal opinion, but that's just fine. Okay. Where am I here? Oh, I think I lost it. Mental, what line am I on here?
28.
28, thank you. Oh, there you are, sorry. Thank you. Is shortness of breath without a fever or cough likely to be corona? I have shortness of breath, but no other symptoms. No fever or cough, though I have mild sore throat a week ago. I am asthmatic and take preventative every morning. Now my breathing is very labored. Mada won't allow me to test because I don't have any other symptoms and I wasn't around infected people. What should I do? Oh boy. Okay. So this is exactly what I was talking about initially. This is someone who has symptoms that could be corona. I mean, they're having some shortness of breath. Again, maybe I should go through that for a second. Symptoms of possible corona, fever, or doesn't have to be and fever, or cough, or shortness of breath, or other upper respiratory tract infection symptoms like runny nose and that kind of thing. And you're right. I mean, the symptoms are consistent with corona, but you don't fall into the criteria of someone who is a rule out corona because you don't have an exposure, you haven't traveled, and you haven't been in close contact with someone who is a known positive. For that reason, you're right. They will not test you, and they haven't expanded testing yet in the country. That might have come up, but again, I spoke to the Ministry of Health about this really in the last day, and that's not the directives now. But things are changing so fast, like literally we can get change of directives within 24, 48 hours all the time. So that is not, they won't test you. What should I, you're someone who seems to be having an issue. Obviously you're having a medical issue. It sounds like either having an asthma attack or short of breath. And this is what scares me a little bit. I'll tell you why. I mean, you particularly, but I mean, in my job at Terram, we're getting a lot of patients like this who are kind of stuck. Their family doctors are saying, you know, you have symptoms that could be respiratory, try to stay home and don't come in. And then you have Magin which is saying, well, you know, you don't really fall into the criteria for testing, so we're not going to take care of you. Thank you. We're not going to send you a test. And we're seeing a lot of patients like that actually in Terram, where I work, where we will of course see you. You know, if someone comes in, you know, all the other diseases in the world still occur just because corona is here. People are still having asthma attacks, and people are still having pneumonias that are not corona, and people are still having cardiac chest pain, and people are still getting appendicitis, and people are still getting, you know, just common colds. All the rest of the world continues with their diseases despite corona. So if you're someone who's having these symptoms like shortness of breath, you need to get checked. If the kupa, if you're kupat cholim, for those of you who don't know that, if you're not in Israel, you're the HMO who covers you. If you're will only see you via telemedicine and you feel like you're getting to the point where you need a physical exam or treatment, then we will see you at Terram. I gave an example of a 60-odd-year-old woman I saw a few days ago, or last week now, I guess, who came in with similar symptoms and no one would take care of her. And at the end, she was having a pretty bad asthma attack and needed IV steroids and inhalations and all that stuff, and she got much better. Or I had a child with fever for quite a few days and a cough, and again, you know, via telemedicine, they thought, okay, you know, stay at home and call Magin David Adom said, well, they don't fall into the criteria. And kid came to Terram and an X-ray had a big whomping pneumonia. Again, not rule out corona, but just a regular old pneumonia. So if you are feeling unwell and you have those kind of symptoms, then I think you need to be checked. So either through your family doctor, if they will see you, and if not, we will always are there and available to see you at Terram. Okay. How safely we covered that, you're right. Does anyone have any idea at all when we will be able to safely fly to the UK and USA from Israel? Oh boy. No, no one really knows, I'm sorry. Again, I don't think we're talking about weeks. I think we're talking months. That seems to be what the people are saying, although not officially yet. But I wish I had a better timeline for you, but no one knows. Again, we're living in an unprecedented territory, and I don't have a good answer for that, but I would be ready for months as opposed to weeks personally, and I hope I'm wrong. Can the virus be present in chlorinated swimming pools? Answer is likely not. It does not look like the virus is transmitted through water in pools or in the mikvah or anything like that. Is playing tennis okay? I like that question. Is the relative risk of incidental contact offset by positive exercise? Oh, I like that. Okay. Tennis is actually a pretty good sport. You're pretty far away from each other. But again, we're supposed to be at home. We're not supposed to be out for that long. You know, it's okay to go for a run. Is it okay to play tennis? It's kind of borderline. We're supposed to be out for like X number of minutes and then not be out too much longer. Exercise is always good. I'm always a fan of exercise for physical and mental reasons. And, you know, but I'm not sure you can compare the offsetting the risk of contagion of being outside and, as opposed to exercise. Exercise is great, but it's not going to decrease your chance of being exposed when you're out. So, although tennis seems to be a pretty good exercise to do because it's far, you play a short, quick game and go home. I think it's probably okay as long as you're careful with the, not touching your face, touching the touching the racket, tennis racket, and then touching your face after and all that stuff, which might be more difficult. Again, that's more the concern, more than anything else. But yeah, hope that answers that. If I begin to show symptoms, what should I do? At what point does one go to a test or the hospital? Again, the test is, like I'll say it again, the test is only given if you are someone who it falls into the criteria for rule out corona, which we said was as travel in the last 14 days, or being in contact with someone who's a known positive. If not, you will not be tested at this point. That could change by the next time we have one of these if we do. If you don't feel well and you just feel like a light cold, cough, runny nose, whatever, again, try to stay home. You can be in touch with your family doctor who often have telemedicine who can see you. But if you're really feeling really unwell and you think something is wrong and your family doctor doesn't have the capability to see you, then I would suggest getting treated, and Terram would be a good option to come to get whatever tests you need. I have heard that the virus can be airborne, and even walking from far away from people is dangerous. Is that true? Does the health benefit of a walk exceed the risk? So it seems that the virus is mainly transmitted again via respiratory droplets, and that can last in the air a little bit of time. But again, if you're about 2 meters away with someone going for a walk, that shouldn't not really increase your risk. You should be okay to do that, and I think it's good to do that. And I'm going out for walks, taking the kids out for walks, and there's a benefit of what exceed the risk. I think there's definitely a benefit of going for a walk, and I don't think there's really that risk as long as you're maintaining the distance that's recommended. Okay. Is that the end? How are we doing? Oh, we're 9:23 already. I think that actually ends the Google document questions.
David, I'm gonna prepare for you a Google Doc with all the chats in a Google Doc that I'll share with you in just a moment, but you can start reading from the chat window.
Okay, thank you, Randall. I have 3 children currently in bidud. When they reach the end of the mandatory 14 days, may they immediately return to all normal social interactions. If they are asymptomatic and they never needed a test, and they've done their 14 days and they feel well, then yes, they can, again, normal social interactions, the new normal, not the old normal. So the new normal, they can go out and do what everyone else in the world is doing in our quarantine lives, but they can't go and do anything, anything more than that. So when I say the normal interactions, I mean the new normal that we're all dealing with, not the old normal from, a few weeks ago or a month ago. It seems like, 20 years ago. I suspect that one child in bidud, for those who don't know, bidud means isolation, may have the virus. How do I go about having her tested? If she tests positive, how do we count? Okay. So if you think someone is in isolation, and if they are having symptoms, that is exactly the reason to call Magin David Adom, and they will then come do the test. It may take a day or two, but they will do the test, and now they're starting to have those areas where they'll do drive-through or they come to your house, but they will and then take over from there. They will do the test. If the test is negative, you continue as you did. If the test is positive, and then that's a whole different story, and they take over, and then you have to obviously, there's 3 options for that. If you're someone who is positive corona, either they're admitted to a hospital, they're admitted to one of the hotels, which we now know they're observing patients in hotels. There's 2 hotels across the country that are designated as corona positive observation hotels, or actually quite a few patients at home over the last week who are stable patients who are doing well, who are being monitored by their Kupat Cholim at home. Okay. Let's see here. If a child tests positive, does the entire family go into bidud? So if someone was positive, for corona, then anyone who was around them for that time, the 14 days, have to go into isolation as well. And that's what happens all over the place. That's why the Ministry of Health is putting out these long lists of where people have been, and now we're being tracked, as you know, by military technology that will tell us if we were next to someone. And if everyone just saw, there was a new app that came out literally 10 minutes before we went online here. Everyone see that? There's an app called Hamagen that just came out on the ministry site, and you can download it on iTunes or whatever, and it basically tracks your phone and tells you if you cross anyone who is next who is corona positive. It literally just came out an hour ago, whatever. So yeah, so anyone who's had direct contact with a corona positive patient has to go into isolation as well. What is the typical recovery period? I guess that means for someone who is tested positive. That's a good question. It's usually, from what I can see, anywhere from 2-3 weeks to a month. And again, to know that you're truly recovered, you have to have 2 negative tests, and that's all arranged through Magin David Adom and the Ministry of Health. They take care of that before you know that you're truly recovered.
David, you can check your Google Doc online. I just shared with you a document. I'm going to format it for you.
Okay, it's the format. Oh, I got it. Okay. I get it.
Do you have that? It's called From Shlomo D to Everyone.
No. Where would I find it?
It's in the check your email.
Okay, 1 second. Sorry, guys. Let's refresh here. Got it. Okay. Opening. Got it. Okay. It's backwards in time. So forwards in. Okay. Can the virus be transmitted? Got it. Thanks. Thank you, Wendell. Can the virus be transferred on clothing? Theoretically, yes. It can live on clothing for a few hours. But once again, that's not the main way the virus is transmitted. And you would need a large amount of virus to survive on clothing and then touch it and then smush it into your facial, nose, mouth, and eyes and stuff. And again, the hours that they tested the virus on surfaces is usually sort of in ideal laboratory settings, but in like real life, things don't live that well on surfaces. So again, we all have to take precautions and be careful and wash your hands a lot, but that's not the main way you're going to catch coronavirus. How does cracking down harder speed things up? It would flatten the curve, will also lengthen the process. Excellent question. I'll try to answer it quickly because it can be like a few-hour conversation. Yes, it's true. It could make things. Oh, my internet connection's unstable. Everyone still hear me fine? I'm good. Okay. Thanks. So it can make it a little bit longer, but that's so much more worth what happens if you have a peak. Like look what's happening in Italy, where the peak was exponential, and the mortality rate in Italy is almost 9%, as opposed to, for example, under 1%. What is it now in South Korea is like under 1% when people take it seriously, and it might last longer when you flatten the curve. But the mortality rate is, you can't even compare that. So certainly yes, but also when you crack down on things and make things harder, you can also decrease the amount of people getting infected. When you isolate people early, when you increase physical distancing, when you have a chance actually to decrease the height of the curve, to actually get less, not only the height, sorry, but the amount under the curve to get less people infected. So you can actually decrease the amount of people who are infected when you do it in a super strict way, not in a sort of halfway, but in a more hard, stricter way. Not only will you flatten that curve and decrease that mortality rate, but you will also get less people infected. And that's really the goal. Okay, we talked about that. Again, asking about the immunity, or can we test after if we're right now we're just seeing if someone is positive or negative and seeing if they have the two negatives, but looking at the different immunoglobulins to see if they're carriers or not carriers. We're not there yet. This is still too new. And again, like you check, someone asked to be checked out for measles and all those other kind of things that we're used to, rubella and measles and all, for example, people have gone to pre-pregnancy titers and all that stuff, hepatitis. We're not there yet. Do I know anything about the virus being in Europe as early as November or December? I think it's a bit early. I think November, December was more when it started in China. Certainly it's called COVID-19 because it sort of came about in China end of December. Likely it was in China, but earlier, like end of November, early December, most likely from the epidemiology. But I'm not sure about it being in Europe that early. I think we were just seeing it in China around that time. Okay. Can you demonstrate how to remove gloves? I don't have gloves with me to demonstrate how to remove them, but I promise, go on YouTube and you can write, and you can look up how to remove gloves, and the medical word for how to remove not just gloves but everything is called doffing. Donning and doffing is the, and there are right now many YouTube videos that will do a better job than I will putting on gloves. Okay, someone asked again about the women's mikvah, which I talked about, I hope already, a few times, but in case someone's late, because I think it's important, I'll say it again, sorry. That the mikvah is just as risky as going to the makolet. The virus does not transmit through water, and they're adding extra chlorine to be extra careful, and just the same hygienic, washing your hands a lot and whatever, and staying meters apart from someone that you would do at the makolet, similar to the mikvah. And the mikvah doesn't increase your risk because you're going into the water. If one must fly, we talked about that. Flying is super risky. Try not to do it. If you must, then, try to wash your hands as much as possible. Stay away from people as much as possible, which is almost impossible on a flight, which is why it's very risky. But I have no great insights into that. It's really not much one can do there, except for just the regular hygienic stuff. And again, I talked about the gloves and I talked about the masks already and how useful or not they are. I saw pictures of people at the beach in Tel Aviv. When the weather warms up, is it dangerous to go to the beach and swim by yourself? Not so much. I'm not sure the right word is dangerous, as opposed to very much illegal. We're getting to the point now where they signed a tzav, where they're signing they've changed it from a recommendation to a directive that one should not be outside on public beaches. All the beaches are closed, and as are the national parks. Again, it's to decrease movement everywhere. So as difficult as it is, it's now not even an option. I mean, it is literally illegal at this point to go to a beach, national park, and those are closed. Okay. Can you comment on when someone in your household is told to go into bidud for a week, and you've all been together that first week? Okay, that's a great question, and what I'm getting a lot. So often, people are told, well, we found out that 5 days ago you were exposed to someone who is positive corona. So you need to go into isolation now to complete the 2 weeks. But you've been for the last 5 days hanging out with your family like everything's cool and no issue. What does that mean for your family? So again, remember, when you go into isolation, you are at this point considered healthy. This is preventative isolation. And there's no what we call in Hebrew ma'agal sheni. There's no secondary circle. So so anyone else who was around you, you're not a positive corona patient. You're a now going into isolation patient. No one else needs to go into isolation because of that. So it's only on the person who was in direct contact with the corona positive patient. And even if you were hanging out with other people for the few days till you heard about it, they need to go into isolation. You need to complete the 14 days, but no one else around you needs to go into isolation. They can, as long as you are doing isolation as you should be doing it, everyone else can go about their lives and don't have to go into isolation either. And I get that question quite often about people who were, I was in contact with someone who's in isolation, they're feeling great, but now I have a cough and a cold. They're feeling great, and they were the one who was in contact with someone. So again, you are not considered a suspected corona patient because you were not in contact with a positive patient. They're feeling great at home. They're not corona positive. You were just in contact with them. So there's no secondary circle. It's only the direct person who was in contact with the corona positive patient.
David, how much more time do we have?
Few more minutes. There's a lot. Oh boy, a lot of more questions. I'm just gonna flip through them.
Maybe we should put a stop to the questions so that you can get through the rest and then call it a night.
I'm gonna do that. Okay, we're getting a bit. So I'm gonna just go through ones I think are important. They're all important, but I can't get to all of them. Can someone in Biduit sit in the garden? And can a family member sit with them at least 2 meters away? So someone who's in Biduit is not supposed to be outside at all. There again, I'll refer you on to the recommendations in English on the Misrad Habriyut on the Ministry of Health website. They're supposed to be in a room with ventilation, coming out only to use the washroom with a mask when they go out. Those are the recommendations. And the bathroom cleaned if they don't have their own bathroom. But to go hanging out in the garden and hanging out outside is unfortunately not allowed. Maybe on a peset, if it's attached to the room is okay, but not like going through the house and just hanging out in the garden and walking back to the house. It's supposed to be only be leaving the room for essential things. Is it true that the virus will die when the temperature goes above 40 degrees? Untrue. We don't know. There are places in the world that have the virus even with warmer climates. Again, the warmer the climate gets in the past, that has, like in the past, especially with SARS, we've seen that once the warmer weather came about, the virus sort of died out. We're not sure it's going to happen with this virus. There are people who think it will not. It might decrease the spread a little bit and decrease its contagion factor, but we're not sure 100%. So it's not true that once we get to the summer, this is all over. Halavai, as we say, we hope so, but I cannot say that for sure at all, and we don't think so. Can pets transmit the virus? No. They actually said the dogs cannot transmit the virus. So all you people who have dogs, love dogs, your dog doesn't have corona. At least not that one. My mother, 78, and her husband need to come to me for Pesach. I can place them in an apartment by themselves and not join us for Seder. Can they sit at our table and they sit 2 meters away from the family? Would be okay. I'm cooking the food. Oh boy. If they really have to come, again, it's not only being at your house, but also the air travel and all that stuff is very high risk. So if any way for them not to come, I would say try to not let them come. But if they must, again, as far away from the kids who could be shedding the virus the whole time. Anyone else in the family could be shedding the virus the whole time. 2 meters away, but like you're really gonna be 2 meters away in a house the whole time. I can't really imagine. If I'm on the table, that's not like the way life works. If it's a must, again, everything's a risk benefit. I can't tell you don't do it because everyone has their own, calculations and shikulim, as we say in Hebrew, in life. But again, high risk, and if any way not to do it, I would say don't. If incubation is 14 days, can a young, healthy person put himself in strictly do it for 2 full weeks and then join another household? That's a good question. But again, it doesn't really, they can, and then but there's still a risk. There's always a risk. It's not perfect. And you put yourself in Bidud for 14 days, then you go join another household, then you walk down the street, and you get in your car, and you catch coronavirus. By the time you're there, you've got it. So,
David, there was one more before about a psychologist meeting patients if they sit 2 meters away in a well-aired room.
well aired room, and again, like I always say, any kind of contact, the less the better. But again, a psychologist is doing important, obviously, or people still come to the doctor, and we still treat treat people at Terran, and psychologists still need to see their patients. So if you're going to see their patients and you need to see your patients, then certainly see your patients by keeping again one patient at a time, which is usually what happens in psychology, I guess, and 2 meters apart in a well-aired room. That would be the ideal conditions to as opposed to being outside, which I guess is not really an option in this psychology office visit. But that if you're going to be an office visit, that would be the ideal way to do it. And people still need to get medical care, right?
Natural
Okay,
remedies.
I'm going to pick the natural remedies. There are many. I don't want to call it fake news, but I don't know what to call it. Many such remedies out there on the internet: garlic, lemon, honey, rectal essential oils. We've seen the gambit of possible home remedies, of which there is zero evidence, including turmeric and all this stuff. Natural anti-inflammatories, all this stuff have zero evidence that this helps. Zero, zero. There's really no evidence for that whatsoever. It may make you feel good and feel nice, and why not? But it doesn't help against the virus. My friend told me that her friend had to wait 6 days to find out she was positive for corona. That's a very long time, especially the person has other risk factors and lung cancer. And you're right, I think Davidodome is swamped, and I think they're doing their best. And you're right, there are delays right now. I know it's a problem with the system, but the patients are being obviously until they get the results, they are being fully isolated. So they're again, there might be a delay in the results, but it's not like they're out there walking around until they get the results. They're completely isolated. So we're again, it may not be comfortable. It might be emotionally and psychologically very difficult for the patient to wait that long to find out if they're positive for corona. But if they're in the proper isolation, we're still stopping the spread of the virus, which is really the goal overall.
I think you covered the next question already.
Yeah, I think I did. My wife is due to give
Birth.
birth in 6 weeks. Yeah, worrying about extra corona precautions at Shaare Zedek. I mean, I'm not sure what else you can do. Like there's still got to give birth and still got to go to the hospital and still got to do it. Everyone's being as careful as they can, and nothing's perfect. But Isha'a Tova is what I can say. And most cases just go fine, and worrying not much you can do in any sense. But again, I think that they're being super careful now, and they're doing their best. And again, things do slip through the cracks sometimes, but they're trying their best to be as careful as possible. How long do respiratory droplets stay in the air? It's a good question. There's a lot of conflicting evidence sort of about that. Again, you want that initial when people cough and sneeze, initial spray. The airborne part, it certainly can last. People are saying 20 minutes, 30 minutes. You're not talking about lasting 9 hours like on the surface. Possibly, but again, there's not exactly sure exactly how long you can be infected from like a respiratory droplet hanging out in the air, and that the main way you're getting infected is from more the direct respiratory contact. Is pregnancy considered at risk? Pregnancy is not one of the major risk factors for making you have more serious illness at this point. Is going to Terram at risk getting infected, given the likelihood that someone who had it visited there for treatment? Someone asked me about Terram. I will say no, because at Terram, our goal is to treat everyone who needs treatment, but people who are coming to us to get a test for corona don't really come into the clinic. When someone comes in and they're doing well, and they're saying, well, I was in contact with someone, or I just came back from the States, then we redirect them home to call Magin David Adom to take the test. And our goal is really to treat everyone who has all other medical conditions. So people who do not fall into the criteria for corona, but still have all the other medical problems. And of course, we have to still gown up, and we still have to put on them surgical masks, and we still have to, when people have respiratory issues, just in case, and we still follow all the directives of the Ministry of Health, which are now, to wear a mask basically for every patient encounter, especially when it's respiratory, but we will still care for you. If you do not fall into the direct criteria for having a positive corona, people just want to come for the test sort of. Obviously, sometimes, which is very rare, you could have a patient coming who falls into the positive corona or rule out positive corona patient, but they're quite unstable. And if they're unstable, of course, we'll stabilize them and then get the ambulance to come take them directly to the hospital. And then we have a full sterilization procedure. We have boxes ready. We have the cleaning equipment ready. And the room is closed and not used for 2 hours after a full bleach clean. And we have, whatever the Ministry of Health advises for that, we do. So I would not be nervous about coming to Terem. If you need urgent medical care, certainly the need for the urgent medical care far outweighs the nervousness about catching corona at Terem. Someone asked, here's a good question, how do we decide when it's worth the risk to bring your children to the doctor for other things? How can we keep little children safe from germs in the doctor's office, right? So that's a very good question. I think the general recommendation is any kind of mild colds, cough, things you would just kind of get checked that the child looks well and, you're not nervous and the child's eating, drinking and all that kind of thing. Maybe it's better to wait a little bit as opposed to rushing into the doctor where you might have done it for some self-reassurance, but the child looks quite well. If a child looks unwell, if a child's not eating, not drinking, not making wet diapers, vomiting consistently, anything that a fever that's more, for example, more than 3 days, or fever in a younger child under a year that lasts more than, a few days, especially, then that's a reason to go see the doctor. And again, I'll reiterate, go see your family doctor. How do we keep children safe? Don't let them touch things as much as possible. Keep them away from people as much as possible. And again, if you're at a state, I'll reiterate that again because I'm seeing so much of this, that if the doctor is unavailable or if the doctor is only telemedicine and you think something's wrong, then please, 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 at Terem, we will see you. We see everyone. We're open. And I think it's important to know that don't wait too long at home. We've seen a few cases of that, of people deteriorating because they were too nervous to come and their medical condition getting worse. And I think it's important to know that if you're nervous and if the Kupat Cholim is unavailable, then please don't wait too long. Then come see us.
All right, does that wrap it up, David?
I believe that wraps it up. Is there any other thing? I think we touched upon most of them.
David and I we'll discuss a session for next week.
We'll discuss.
And if we have one available, we will publicize it in the same medium as we did before on Facebook on the Yishuv list. You can email me at mgottesman@gmail.com if you want to get an update or if you didn't get the link to the YouTube that we post tomorrow. Have a good night. Thank you, David.
I'm interrupting you to say a big thank you to Mendel because I can probably send a WhatsApp or an email, but without him, this would not happen because I don't really know what I'm doing with all this. So without Mendel's imperative to all this, thank you so much, Mendel, for all your help.
Stay well, stay home, stay healthy. Good night.
Wash your hands.
Wash your hands.